The World Health Organization's Director for Africa, Dr. Matshidiso Moeti, has warned that richer countries are already appearing to be hoarding monkeypox vaccines. The health organization says that Africa has no vaccines and that test kits are in short supply. Monkeypox has been recently reported in countries with no history of human transmission, including Ghana, Morocco and South Africa. Dr. Moeti says that what has happened in the early days of COVID-19 vaccine rollouts, when Africa watched on the sidelines as other countries snapped up limited supplies, must not be allowed to reoccur. She's added that monkeypox vaccines are in short supply globally and there have been no donations to countries on the continent. Well, for more on this, we're now joined by Dr. Mary Stephen, who's a technical officer at the WHO's Regional Office for Africa. Thank you so much indeed for joining us, Dr. Stephen. Welcome to the program. We've spent so much time over the last 2 years talking about COVID-19, and now we're facing another issue, monkeypox, and yet the drama is the same, and that's vaccines for Africa.
Yes, thank you for having me, and good evening to you and all your viewers. So the monkeypox outbreak, as you know, the spotlight started in May 2022, but of course countries in Africa have been responding to monkeypox outbreak because we have a number of countries that are endemic. So far with regards to vaccine, no country in Africa has used monkeypox vaccine for response, and we currently do not have access to this vaccine on the continent at the moment, but there are discussions at the global level discussing how the mechanism would be in terms of ensuring access to countries, especially in Africa, to avoid what happened during the early stages of the COVID-19 pandemic.
Does it look like that it will happen in the same way as the COVID-19? Because these developed nations will look after their citizens first.
That's why the discussion has started already to mitigate the lessons we have learned from the COVID-19 vaccination, like I said, during the early stages of the pandemic, to ensure that once these vaccines are available, there is equity in terms of distribution. Yes, we know that the vaccine is not the only solution. Of course, other public health measures are deployed in terms of the response, but it's an additional measure that could help in terms of preventing the spread of this disease. And once it is available, definitely we call for equity in distribution for countries in Africa.
I believe monkeypox was first diagnosed in 1958, and that over time it's been pretty endemic on our continent, West and Central Africa, and that we actually have thousands of cases of monkeypox each year for quite a long time now. And I just wonder, as we cry for vaccines, what have we been doing to manage over so many years?
Yes, you're right. So after the initial detection of monkeypox virus among monkeys in Denmark in 1958, cases started being reported on the continent in 1970, specifically in Democratic Republic of Congo. And then we had cases in other endemic countries such as Nigeria. So for instance, a very good example is Nigeria. Although DRC situation is a little bit different because cases have been reported, Nigeria has had a period of like 40 years from 1978 with no case until 2017 when monkeypox cases started re-emerging. And a very good example is what the country did to quickly ramp up the capacity for surveillance and testing of the monkeypox virus itself, then care for the patient. Of course, looking at other preventive measures like risk communication. So from the regional perspective, what we have been doing when we revised the guidelines for surveillance in 2018, 2019, we added monkeypox as one of the priority diseases for surveillance for countries to continue to do surveillance. And most of the endemic countries, of course, do have capacity. If you look at it, they all have laboratory capacity. DRC has capacity to confirm. Nigeria, Central African Republic, Cameroon, all these countries have capacity to confirm monkeypox, but we also have countries like South Africa, Uganda that are able to confirm the monkeypox. But the capacity generally on the continent for laboratory is still not as optimal. All countries have the PCR machine, but they still need reagents. They still need training in terms of sample collection and diagnosis of the monkeypox itself. Then another important aspect which we have learned from the COVID pandemic is risk communication. Passing the right information to the general public to know how this disease spread and how they could prevent themselves from getting exposed to these diseases. So all these have been happening, but of course at different scales in the different countries because of their level of risk.
All right, so where are we on the continent at the moment? One gets a sense that, monkeypox has become a buzzword because it has hit parts of the world that it has never hit before. We've been dealing with it for decades, and I just wonder, have we seen a spike on the continent, or are the numbers relatively the same as we've been seeing in previous years?
Yeah, so if you look at the current outbreak, taking out the other parts of the world, focusing on Africa only, majority of these cases are actually coming from the Democratic Republic of Congo. It's actually constituting about 81% of all the more than 1,800 suspected cases and about 109 confirmed cases across Africa. The next one that is following closely is Nigeria with about over 160 cases. So if you can see the difference is currently very huge. So that's where the greatest burden lies. But we are seeing cases happening in countries, like you earlier said, that are not endemic for monkeypox and haven't reported monkeypox outbreaks before, like South Africa, Ghana, Morocco, and especially the South Africa one, no history of travel to endemic countries, which requires further investigation. And that's part of the things that are actually unusual about this outbreak. But if you compare what we have seen in previous years in these endemic countries, we have not seen like increase in number of cases, but this unusual event where we are seeing countries that have not reported monkeypox but before are currently reporting calls for a more sustained action and alert by all countries on the continent.
All right, so is there a cause for alarm at this stage, or is it still manageable? Because I remember the WHO got into trouble last time for not being quick off the mark with declaring COVID-19 a global pandemic.
Yes, so for Africa, it doesn't mean that because this emergency is not a public health emergency of international concern that countries should go to sleep. We need to wake up. Especially the fact that we are seeing a different trend with countries that are not endemic, reporting cases not linked to travel history. It means that something is definitely happening, and countries need to take action right now. So the non-declaration of fake does not mean we shouldn't take action. WHO is supporting countries to continue to ramp up their ability to detect early, making sure that the surveillance is working. They are able to confirm these cases, and risk communication is ongoing, and also provide clinical care to those that are infected to make sure that we contain the spread of this monkeypox outbreak. And countries that haven't reported cases, they need to be ready. there is no room for complacency. They need to make sure that all these capacities are in place, and they are actually actively looking for these cases. Peradventure, these cases might be found in their own countries as well.
All right. Do we have any idea which strain of monkeypox is most prevalent at this stage? Because there is one, I believe, that's a little bit more virulent than the other.
Yes, so there are two clades of monkeypox. The West African clade, which is a bit more severe, the one you see in DRC and the Central African clade, the one you see in DRC and Central African countries. The less severe one is the West African clade, and that's the most common virus that is found even outside Africa right now. So this is the less severe form of the virus, but we need to be vigilant. We need to be vigilant because this virus has the potential, of course, to spread, as we have seen. So, but we have an opportunity to contain it. Like I said, in 2017, in Nigeria, we didn't have all the measures, but we were able to bring this outbreak under control, despite the fact that it appeared 40 years after the previous cases. So there is opportunity for containment here if we can take action quickly, and we need to make sure that this action is definitely ramped up in all countries that are affected, but also countries that do not have cases, to make sure that they are prepared to respond.
Dr. Mary Stephen, always great talking to you. Thank you so much for your insights as always. Thank you.
Thank you for having me.
All right, that's WHO in the Regional Africa Office, Dr. Mary Stephen, talking to us about monkeypox and the challenge that we're facing on the continent, access to vaccines, which is starting to feel a little bit like the beginning of the COVID-19 rollout of vaccines.